Hi, I'm Raina Morgan with iHealthTube, visiting with Dr. Aaron Katz. He wrote the book Prostate Health, and that's what we're focusing on. And Dr. Katz, I wanted to present a scenario where a man is 40 years old. He doesn't have any symptoms, but he comes in for a visit with you. What would you suggest to him to stay normal? I mean, his PSA is normal, and what would you suggest?
Well, I think that's a great question because we're trying to be proactive here in this country, and we know this disease is so prevalent. So we need to get these patients and these men in this country in earlier so that we can change the course and the direction of this type of a cancer. Because as we mentioned, it is a major health concern in this country. So for this particular man that comes in, the first thing that we need to do, and again, we don't always focus on the prostate and the bladder, we need to look at the whole body himself. Does he have any other ailments that are going on? Because we can't forget about the heart, which is the major killer in men right now. And we also need to know, does he have a family history, which would put him at a higher risk of prostate cancer? Or is he African American? But if he doesn't have any of those high-risk features, and he's a fairly healthy guy, he's in good shape, he exercises regularly, which is something that I like to ask my patients, are you active, what is your cholesterol level? Making sure that he's not overweight. Then I would implement some of the nutrients and supplements to try to prevent him from having prostate conditions in his 5th and 6th and 7th decade of life, such as the compound that we're studying, which would be important, Zyflamend. There's other antioxidants that have been shown to be helpful in low doses, like selenium, like lycopene, like pomegranate juice extract, green tea, which has been a wonderful antioxidant, and trying to maintain a healthy diet, organic foods, reducing red meats, reducing fried foods, reducing the amount of sugars that we take into our diet. I think all of those, as well as understanding what he does for a living, how much stress he's under each day. Is he a guy that's working on Wall Street, that's dealing with the stock market every day? Does he have any outlet to reduce that stress? Does he meditate? Does he do yoga? So all of these, I think, are very important in incorporating lifestyle changes for these patients.
So that's what it's about, for him to stay normal, this man who's 40 years old, who's not at risk at this point. For him to stay normal, he has to really make lifestyle changes at 40.
I think it's very important, and I think that's where men get into a difficult time of their life. You know, in that 40 to early 50 range, they're a little settled, maybe they're married, they have a few kids, and that's when they need to be more proactive.
And that's what it's all about. To stay normal, you have to be proactive.
Yes.
So you can't just coast any longer. You've got to do some decisive things.
You do. You have to stay active. You have to be, you have to be exercising at least a few times a week, aerobic exercising, running, swimming, biking, going to the gym, weightlifting, eating right. And all of those things will, if this is the most important thing for men, which is their sexual function. And all of those things, maintaining a good body mass index, not being overweight, maintaining good aerobic exercise will not only keep your heart healthy, but it'll also keep your sexual function healthy.
All right. Well, thank you very much, Dr. Katz.
Okay, thank you.